All right, well, good evening, everyone, and welcome. It's really nice to be kicking off our Race 360 Global Health Technology Seminar Series. And tonight we have really a fantastic speaker, Sonali Korde. She is the MD Anderson Visiting Fellow at the Baker Institute. Her areas of specialization include humanitarian affairs, international development, global health, and foreign policy. I want to tell you a little bit about her background before coming to Rice. She most recently was at USAID's Bureau for Humanitarian Assistance, where she had a very high position. She was assistant to the administrator, responsible for overseeing efforts to save lives, alleviate suffering, and coordinating our government's international disaster response. She also held the position of acting deputy assistant administrator at USAID's Bureau for Legislative and Public Affairs, where she managed strategic engagement with Congress. She negotiated legislative and budget issues related to foreign policy and international development. She was part of the National Security Council staff, where she served as Director of Global Health and Development. Helped with responding to the Ebola response in West Africa, and helped address emerging infectious disease threats like MERS and Zika. And she also played a key role in launching the Global Health Security Agenda. Before she joined NSC, I learned that she worked for one of my heroes, Representative Nita Lowey, where she was a Foreign Affairs Fellow. She has an MA in International Affairs from Yale University and a bachelor's degree in economics from NYU. And tonight she'll be talking with us about the role of Congress and the National Security Council in foreign policy and global health. So please join me in welcoming Sonali Korde.
Well, thanks so much for having me here. It's really great to be here and see all of you. And we're going to try to make this an interactive, lively kind of a conversation while I'm going through it, and lots of opportunity to ask questions and reflect and discuss. So what I'm going to do is first start with Congress, otherwise known as the Hill, and then we'll talk about the National Security Council and how that works or sometimes doesn't work. So basically, how many of you guys have been to Washington, D.C.? All right, pretty good number. So if you've been to DC, you know that on Pennsylvania Avenue, on one hand, you have the White House, and then on the other end, you've got Congress. And if you are a government worker or part of a department or agency, or actually in the NGO community or the advocacy community, you're kind of stuck in the middle of these two big behemoths who will influence a lot of what you do. So let me ask you guys another question. Who does foreign policy in the United States? Which department, which entity? Anyone want to throw up a hand? Go ahead. Aha. Okay, I knew you were going to say that. And you're not wrong, but it's not only the Department of State. So we're going to talk about why and how the White House and Congress are equally, if not sometimes more important than the Department of State in policy making for foreign policy and even global health, more so than the actual Department of State or the agencies that do the implementation. So let's see, I have to learn how to click these slides. Here we go. Aha. So Congress and foreign policy, most of you guys are too young to remember this, but if you ever want to take a look, you'll probably find it on YouTube or something, but there is a cute little cartoon on how a bill becomes a law. That's kind of how it works, so I encourage you guys to watch it. And there's a nice little song that goes along with it too. If I knew how to embed a video in the PowerPoint, I would have done that, but that's too advanced for me. So why should anyone even work with Congress? After all, they have just shut down the government. They're constantly squabbling. And you can't really get a straight answer or even a congressional view on anything. But let's talk about why anyone in the federal government needs to care, but why anyone should care at all, even as a citizen or somebody who cares about global health. Well, the first is just to expand awareness and support for an issue. So if you go back to the creation of PEPFAR, which I'm sure you all know about, it was really Congress and bipartisan support that not only helped create PEPFAR, but fund PEPFAR at very robust and high levels. So that's an example of how influential Congress was. Secure resources, and we're going to talk about this in a minute, but Congress appropriates funding for the federal government, full stop. It comes from Congress. There is a constitutional battle going on right now on who controls those resources, but Congress has the power of the purse, and we'll talk about that. And then obtain needed authorities. So if you're in the federal government and you are part of the Department of State, or you're the Department of Interior or Department of Defense, your authorities, which is the legal backing, the legal permission to do anything, spend $1, hire a staff person, buy a pencil, conduct a war, all stems from authorities, from legislation that is passed by Congress. So that's why, as difficult as Congress is to deal with, most of us have to deal with them at some point or another. So we're going to go back to the point I made about securing resources and the constitutional power of the purse, which is spelled out in Article 1, Section 9, Clause 7 of the Constitution. And if you do any work on the Hill, you'll have this memorized. But otherwise known as, the popular phrase is called "the President proposes, Congress disposes." So first, and arguably, frankly, the most important reason to care about Congress is the constitutional power of the purse. If Congress does not act every single year to pass a budget or an appropriation, you have what we have right now, which is a government shutdown. Moreover, Congress actually decides the level of funding for each of the departments and agencies. And moreover, they can go down to very small amounts of money and say, well, money goes to PEPFAR, but money does not go to non-communicable diseases. Or Congress can say, money goes to Ukraine, but it does not go to Iran. And they can write that in legislation, and that's law. And the executive branch, once it's passed, has to follow that. And those are called directives or earmarks. So Congress then and the Appropriations Committee have a lot of power over what goes on in the Department of State, the Department of Defense, the intelligence communities, the entire national security apparatus, because they can write in language that specifies to the dollar exactly how much is going to be spent. So that's a huge amount of leverage and power. The second reason, well, I'll come back to that actually. Let's talk about who is Congress. The House of Representatives, 435 representatives. They're elected every 2 years. The Senate is 100 senators, 2 senators per state, elected every 6 years. Popular lore is that the House tends to be a little wilder, a little more animated, and the Senate is supposed to be, I think it was the founding fathers, is the cooling saucer. Let's temper that crazy House a little bit, all 435 of them shouting. It's important to know, if you're watching what's happening right now in Congress, is that the House is really a majority rule. So you need 217 votes, and it passes. The minority, whoever's in the minority, has very little power when you're in the House. The majority kind of runs everything. That's not so true for the Senate, because the Senate rules have things like needing 60 votes to break a filibuster or needing certain vote thresholds to pass legislation. And when you have a majority, like the Republican majority in the Senate, but it's not crossing that 60-vote threshold, the minority suddenly gains some power. And so this is why you have a shutdown right now, is that even though both chambers are controlled by one party, the minority in the Senate still holds enough votes to basically cause a shutdown and not let certain legislation pass. The Senate is also very important because the Senate does confirmations of executive branch high-level officials. And so that's another reason why the Senate is important. That said, you can't pass legislation without it going through the House. So, lest the Senate gets too sort of full of themselves, the House is always there to kind of snap back the suspenders and say, hey, you still need us. And so that causes a very interesting dynamic between the two chambers. So, oops. Okay, congressional stakeholders. All right, so I talked to you about appropriations. Then there's authorizing legislation. And authorizing is where a department or agency's legal authorities come from. So again, going back to global health, under PEPFAR and when PMI, the President's Malaria Initiative, was started, and when the Global Fund was created, Congress passed authorizing legislation which gave State Department, and when USAID was still there, very specific and unique authorities to do things for those programs. And those are written into law. They didn't just exist, and the executive branch couldn't just come up with them. They actually needed to be passed into law. So that's why the authorizers or authorizing legislation is important. And that brings us to what we call the four core. What's important to understand for any topic or department or agency, there are committees set up that deal with those departments and agencies and also those specific issues. So sticking with the global health theme, most of global health is now run out of State Department. So there are two committees that do authorizing legislation, which is Senate Foreign Relations Committee and House Foreign Affairs Committee. And then there's two committees that do the appropriations legislation, which basically these are the committees that decide how every dollar is spent. And that would be the Senate Committee, Appropriations Subcommittee on State Foreign Operations and Related Programs, colloquially known as SACFO. The House Committee has changed its name in recent months. I can't exactly remember what it's called, but it's the House Appropriations Subcommittee on State Foreign Operations and Related Programs. It used to be called HACFO. It's called something else right now. I'm sure it's going to change back to HACFO. But anyway, it's the House Appropriations Committee is what you need to remember. Now, every department or agency, and frankly, every issue that you can think of, falls within the jurisdiction of one of these committees. So for example, you would not be really talking about global health issues or PEPFAR or maternal child health to, say, the Defense Committee, because they just won't care. It's not their jurisdiction. You're going to go to either one of the health committees, or more importantly, you're going to go to Senate Foreign Relations or House Foreign Affairs or one of the appropriations committees, and then you're going to tell them why you think it's important. These committees basically do both authorizing legislation. The Senate Foreign Relations Committee is very important if you ever want a high-level position in a future administration. They're the ones who will confirm you or not confirm you on a bipartisan basis. And then the appropriators are extremely important because, again, they decide how the money is spent. If you're a department or agency, all of these committees have oversight over you. So it's not just like they give you things like money. They get to ask you questions and pull you up for hearings and interrogate you. And sometimes it's very unpleasant. I can tell you that from personal experience. They can subpoena you. They can compel documents. So again, these committees have a lot of power. And so most departments try to manage the relationship in a very, very careful manner. These committees will also listen to private citizens, NGOs, advocacy group, and take in all of that input when they're crafting a budget bill. So feel free to go visit them. Let's see, others that matter on policy. There's other entities that matter as well. Personal offices of members that are interested or sit on these committees. There are caucuses on every topic under the sun. There are subcommittees on the authorizing side. There are budget committees. There's the Congressional Research Service, which is like a library and a research arm that exists for members of Congress and staff. There is the GAO, which is like the auditors and the investigators for the members. So any member can basically say, hey, I want you to go investigate or do an audit of PEPFAR fund spending in Malawi and how State Department's done it and everyone who's received that funding. So that could be a congressional GAO report that will hopefully go smoothly, but can also, cause a lot of issues. And if you're a department or agency, you have to cooperate with them. You have no choice. And CBO, and this is an esoteric kind of issue. They're the ones who score how much a particular piece of legislation will cost the federal government over time. So authorizing legislation is like scored to say, oh, PEPFAR getting an extraordinary authority to do something in Tanzania is going to cost the government X amount of money over 10 years. They have this they call it a score, basically, is how they do it. Let's see. So global health has been a very popular area for authorizers to authorize in. Historically, in foreign policy, it's difficult to pass authorizing legislation. And that is because even when there is a majority across both chambers, you still have these situations where the minority will hold a lot of power, and the CBO scoring will get in the way because then the appropriators have to deal with financing it. So you find that authorizing legislation on foreign policy issues writ large are rare. It's different for the Defense Department. They have authorizing legislation every year. There's just a different kind of political support for Department of Defense. You hear about the NDAA, the National Defense Authorizing Act, that tends to pass every year, or the Farm Bill Act, again, huge constituency there that gets that over the line. Not a huge constituency for our stuff, like foreign assistance or global health. But there's some landmark legislation to note, which the first one is the Global AIDS and Tuberculosis Act of 2000. And essentially, it authorized the creation and contributions, US contributions to the Global Fund. Then there's the famous US Leadership Against HIV, AIDS, TB, and Malaria Act, which authorized the creation of PEPFAR, as well as funding expanded government efforts for TB and malaria. And then that legislation has been amended several times and refreshed. And then there's a few other ones, like amazingly, authorizing legislation for neglected tropical diseases passed, water passed. So it does happen from time to time. I think I would say that even if an authorizing bill does not pass, I would say that there are times when it's worth it for the advocacy community to continue to push around a piece of legislation and work on getting it passed, because it just helps passing legislation and trying to get sponsors and a member office to write it and work with you to try to develop awareness is a good way to get Congress to understand an issue and to potentially support an issue. Sometimes it takes years and years to pass even a simple authorizing legislation act, but it's an important advocacy tool. The last is really just the kinds of communications for Congress. There's hearings. Of course, they call government witnesses, usually unwillingly, but sometimes they call private citizens and different experts. Writing letters. You can always write a letter to your member of Congress. Lobbyists. It's a huge industry in Washington to have clients who need representation and help them navigate the halls of Capitol Hill and help them influence legislation. Congressional notification, that's more of an internal State Department thing, but again, going back to my point that Congress controls every dollar, State Department has to notify when they spend it and how they spend it, and how much they have to notify kind of changes over the years depending on whether the appropriators are angry with the secretary or not. When they're upset with the secretary, those reporting requirements tend to increase. There's a correlation there. Obviously, congressional travel, CODELs are so important. One reason why PEPFAR and malaria, PMI, global health has gotten so much support over the years is that, these CODELs, congressional delegations, the members go out to these countries and they see the work. We used to take them around to go see kids and like hospitals and treatment and all sorts of things, and it really creates an emotional bond, which makes them want to support this. And the last is, these are just kind of like helpful hints on really briefing anyone of authority. So we don't have to go over this here, but next time you're talking to your professors or on a job interview, you might want to just keep this in mind.
I was wondering if you can just go over how the recent shutdowns and the current administration is affecting all of this.
Sure. So I guess a few points. The current shutdown, there hasn't been one since 2019. They do happen from time to time. The current shutdown is a result of the Democrats wanting to hold negotiations and extract some concessions on the Affordable Care Act, like domestic issues, and the Republicans essentially saying, we're not going to deal with them in this legislation cycle. And there's a lot of distrust right now among the two parties. And so I think the Democrats are just kind of holding the line until they extract some concession. Again, we come down to the voting rules and the vote thresholds, which is why the Republicans can't just keep the government open right now without the Democrats essentially helping them with the votes in the Senate. In the House, they're fine. They basically took a majority vote, and that was that. I would say that there's been some very interesting legal questions that have come about that are getting tested in the court systems as we speak. And we'll have to kind of see where some of this lands. And so there have been court cases on whether the administration can, for example, just unilaterally shut down a department or agency. If it was created by an act of Congress, says one theory, then only an act of Congress can basically shut it down. So that's one sort of set of court cases that are being kind of tried out and tested out, including on USAID. Another one is really testing the limits of the constitutional power of the purse in Article 1. And there is something called the Impoundment Act. And the Impoundment Act came around, I want to say, in the period of Richard Nixon. And essentially, the issue there is that consistently, until now, it has been ruled that if Congress appropriates, say, $10, then the executive branch must spend said $10. They don't have a choice. They have to spend that money. Now, if the executive branch does not want to spend the $10, then they can offer up what's called a rescission, which they did this summer, and say, I don't want to spend the $10. I only want to spend $5. And then Congress actually is supposed to vote on whether they agree that the executive branch can only spend the $5 versus the $10. So if you're watching The Hill over the summer, you'll see that there was a rescission proposed and Congress voted on it, and several members of Congress basically really rallied to protect the PEPFAR funding, because that was a big source of the cuts. And that had bipartisan support. Again, a huge lesson in needing bipartisan support for global health and the kind of work we do. And So then they adjusted the package, and then that rescission was voted on. Then what happened? Is the Office of Management and Budget, which is the president's budget arm, proposed what is known as a pocket rescission. So they basically came back and said, I want to say the number is $4 billion, but don't hold me to that. Came back before the end of the fiscal year, so sometime in September, and said, oh, by the way, we don't want to spend another $3. And because of how Congress appropriates that money, it expires on September 30th, which means it kind of vanishes back into the Treasury if it's not spent. I'm going to rescind this money, and I'm going to do it so close to the expiry date that Congress will not have a chance to vote on it, and so therefore it will just expire. And that is known as a pocket rescission because essentially the executive branch is not giving Congress the opportunity to actually vote on the rescission. Well, that went to the Supreme Court because that is really testing basically Article 1. And the Supreme Court kind of came back and said, well, the plaintiffs in the case did not have the legal standing to bring up the case in the first place, and the president has power to create foreign policy. So in this case, so it's not dispositive, which means like basically the Supreme Court sort of kicked it on a technicality, saying it was the wrong plaintiffs that brought up the case, but also kind of noted that the president has a constitutional power to both create and execute foreign policy on behalf of the United States. So this issue is not settled. This was obviously, majority opinion. There was a lot of dissent from some of the liberal judges. So we'll have to see kind of how this all plays out in the courts and really where some of the limits are going to lie. It's very interesting legally, I think.
The timeline between a legislation and real life impact. For example, how long does it take to draft a legislation? And then how long does it take to see the effect on the streets, right? And then the other question would be, what's the lifeline of a legislation? Does it end, does it go on forever? Or is there a time in future when it says, okay, this should be the end of this?
Such a good question. So I'll start with your second question first, because it's easier. If it's authorizing legislation, which tends to be, the creation of PEPFAR, or there's a new legal authority, or the Neglected Tropical Disease Act, Congress will generally enact it for somewhere between 3 and 5 years. And then often it's renewed. And the PEPFAR legislation has been renewed. A few years ago, there was a big issue because they couldn't get the votes to renew it. But generally speaking, that legislation gets renewed. Now, depending on how that legislation is written, that legislation could, even after it's expired, it could be written to have permanent legal authorities. So in the foreign policy world, I'm sorry, this is getting super detailed, but there's something called the Foreign Assistance Act of 1961. That is the permanent body of legislation. Sometimes the authorizing acts amend that permanent body, and then that is a permanent authority until somebody undoes it. Sometimes that authority expires. So it could kind of, even after the legislation expires, that authority could live. So that's for authorizing. For appropriations, they're generally for 1 year or till the end of that fiscal year. And then you need those continuing resolutions, which you may have heard about, whether it's 3 months, 6 months, 9 months, to continue while the Appropriations Committee is processing, reading, learning, considering the president's budget requests, considering input from the communities on different topics, their members' priorities, and writing a new legislation. So what we have right now is a continuing resolution that the majority wants to pass, which is not even the new legislation, while the appropriations committees are writing legislation for 2026, which they're already way behind on. But those tend to be roughly a year. Okay, your first question is how long from passing to finding an impact. So this is where, let's talk about the appropriations, because this is where it matters, because when the money hits the ground is when you see the impact. For most global health programs, when the legislation passes, there's processes where the Office of Management and Budget has to do something called an apportionment of funds to the State Department. The State Department has a lot of internal processes to say, where should the money go? How should we program it? How should we spend it? Then there's approvals at a very high level. Usually, right now, it's through the Secretary's office. There's an individual who signs off on that money. Then that money has to get notified to Congress, which is usually 15 days. Sometimes Congress will hold that notification, which means they're saying that they would object to the department spending that money, either on policy grounds or they have more questions or whatever it is. So realistically speaking, for most global health funding, I would say the fastest that money will hit the ground is like 3 to 4 months, unless it's an emergency. Realistically, it'll take sometimes anywhere from 6 to 12 months. If it's crisis money, like humanitarian crisis, like for the bureau that I just used to run, it could happen like the next day, because we have different authorities to just move that money without too much explanation. I should say we used to. The process is very different now.
Thinking back about USAID, can you briefly explain how USAID was dissolved so quickly, and what does international development look like going forward from the knowledge that you have so far?
It was dissolved quickly because they essentially transferred all the functions to State Department and created like a timeline to lay off all the employees. They absorbed like small amount of people at State Department. And then they went through this rescission process that I just explained, where they basically like gave back all this money to the Treasury, or in some cases, like I said, both questions I think are still kind of playing out in court. Technically, USAID sort of exists on paper. It's not like dissolved entirely, because there's like a statutory person who's like kind of like a chief officer. But it was certainly a surprise. Like it's not how one would normally go about like shuttering an agency, for sure. What happens now? It's been the development foreign assistance financing is now supposed to be managed by State Department. It's very unclear what's going to happen. There is a Bureau for Global Health, and they're going to be doing some global health spending, some PEPFAR spending. They have a new global health strategy. There's entire sectors that, like democracy funding, which they've said they're not going to do any longer. There's a lot of things, like education, they've said they're not going to do that anymore. So it remains to be seen. Like I think this is where the interplay between Congress and the executive branch will play out in the next year. The House passed 2026 like a draft bill for, they call it the House mark for the appropriations bill. And even though the House is completely controlled by Republicans and the majority has complete control at this stage, the House bill actually restored a lot of the funding that was cut. So that's kind of interesting too, that the House actually kind of pulled back to the center without anyone noticing. I know for a fact the Senate's going to do the same. So then the question is OMB going to accept that legislation and sign off on it? Or will they sign off on it and then just do a massive rescission again? We just don't know. All right, let's talk about the National Security Council. All right, anyone who wants to give some guesses? What is the National Security Council? Anyone? You can give a wild guess. Go ahead. Very good. Excellent. That's exactly right. The National Security Council advises the President of the United States on issues of foreign policy, national security, and homeland security. So yes, well done. And it was created in 1947 by the National Security Act of 1947 after World War II, and there was a recognition that, hey, the world is kind of complicated. It's, State Department is just, one organ in the body of this whole sort of apparatus. It's technically an advisory body. It has several members defined by statute, which includes the Vice President, Secretaries of State and Defense. But the reality is, it's whoever the president decides it is. So most new presidents will issue a directive and say, this is who is on the National Security Council, and this is like its mandate. So the National Security Council plays an advisory, policy development, and coordinating role. It is not supposed to do operations or manage operations. So there's kind of limits to what the NSC is supposed to do. It's kind of a fine line. It's sort of a fuzzy area, but there's some cautionary tales around it. But yeah, you're right. The statute, by statute, the functions are to advise the president with respect to the integration of domestic, foreign, and military policies related to national security, assess and appraise objectives, commitments, and risks of the U.S. in relation to the actual and potential military power of the U.S., make recommendations to the president concerning policies on matters of common interest, and coordinate without assuming operational authority the U.S. government response to malign foreign influence. So that's kind of what's written in law. It's pretty broad. You can do a lot underneath that chapeau. But let's talk about who is on the National Security Council, who the president usually says should be on it. So it's the Vice President, Secretary of State, Secretary of Defense. Typically, you would see the Director of the Office of National Intelligence. Typically, you would see the CIA Director at the table, the White House Chief of Staff, the Chairman of the Joint Staff. Secretary of Homeland Security is almost always there. Secretary of Treasury is almost always there. The OMB Director is almost always there. At the NSC level, the attorney, the White House counsel is almost always there. So that is like the NSC, and then there's the NSC. And the NSC is people like me when I used to serve on the NSC. And that is the staff of the NSC. The staff of the NSC is organized by what are known as directorates. There are regional directorates like Africa, Middle East, Europe. There's functional directorates, which kind of change names a lot, but there used to be a global health security directorate. There used to be a development directorate. There has, over multiple administrations, been something called INTECON, International Economics Directorate, different homeland security directorates. And you look, the president gets to decide how the National Security Council is run, organized, or how many people are there. So, the Obama and Biden administration had like over 200 policy staff. The first Trump administration had maybe like, I don't know, a much lower number. Right now, it's a very tiny number. I think the president's just decided he does not need a robust, large National Security Council, but that's his prerogative to set it up the way he wants to. So this sounds very lofty and academic. How does it actually work in practice? So the way it actually works in practice is that the NSC runs a series of what are called policy committees. And there are 5 levels of committees, typically, in most presidential administrations, that will convene to formulate policy, examine issues, go over things. And these committees are chaired by an NSC staff, sometimes the president at the highest level, and comes up with recommendations and agreements on what's going to be implemented. Those are called SOCs, Summary of Conclusions. And it is all sort of tracked and kind of, the NSC staff also writes the papers, background papers, tees up the decisions. So the 5 levels of committees, the first committee, which is the NSC, the actual NSC, and different presidents will convene it at different tempos. think that President Biden probably did less so than President Obama. I don't really know. I think President Trump seems to do smaller ones frequently. The next level down is the Principals Committee. That is typically chaired by the National Security Advisor. So right now, the National Security Advisor is Secretary Rubio. It was previously Mike Waltz. Under President Biden, it was Jake Sullivan. And both the NSC and the Principals Committees are cabinet level. So the attendance is at the secretary's level. And the secretaries generally come to the Situation Room or will zoom in from wherever they are securely around the world. And it will be held in one of the rooms in the Situation Room, just like you see on the movies. The next level is the Deputies Committee, and that is chaired by the Deputy National Security Advisor. In the last administration, it was John Feiner. There's a new one right now whose name is escaping me. And that is the Deputy Secretary level. Now, the Deputies Committee, the past several administrations that I've seen, tend to be where a lot of the work and the decision-making actually gets done. So the Deputies Committee tend to meet a lot more frequently, sometimes multiple times a day on different topics, sometimes multiple times a week. That seems to be like a major engine of like policymaking. The next level down, depending on the administration, is either called the IPC or PCC, the Policy Coordinating Committee, or the IPC. There's something. We used to call it IPC. Anyway, I forgot what the I stands for. I think it's like Integrated Policy Committee. That is chaired at the Assistant Secretary level by the senior directors. And then the lowest one is the sub-IPCs or sub-PCCs, which are done at the director level, at the Deputy Assistant Secretary level. Again, a lot of the work gets done at these lower level committees, so there's a pattern here where the deputies do a lot of the work. It's a life lesson. So that's how it kind of works structurally. In practice, every National Security Council staff really bends to the style of the president. When I worked in the Obama administration, President Obama was a huge reader. He loved reading memos. He was a voracious consumer of information. My national security advisor was Susan Rice. She liked having a lot of principal committee meetings. So if you were on the staff of the Obama NSC, you were on your toes. You were writing for the president. You were staffing the national security advisor. You were writing policy papers. You were helping kind of create what were known as roadmaps for her to run the meeting. Like, what order are you going to go to who on? What are the key decisions you're going to try to tease out? Look, one kind of misconception about the National Security Council is members vote. They don't really vote. The National Security Advisor or the chair of the committee might get views. They'll note who dissents and who doesn't. But ultimately, the decisions are taken at a higher level or taken up the next level, and the president will just kind of decide. So it's not like a voting kind of a thing. You do get to express dissent or different points of view and different kinds of courses of action. One interesting note is the presence of the chairman of the Joint Staff. The Secretary of Defense runs the policy for the Department of Defense and is basically, takes orders from the president to basically give orders to the military. But the chairman of the Joint Staff is invited to provide independent military advice directly to the president. And that's also important too. So it's not like a subversion or like a challenging the authority of the Secretary of Defense, but it is to provide independent military advice. And that is valued. So one last note, since we just covered Congress on the National Security Council. Congress really does not like national security councils, no matter what president it is. And that is because the National Security Advisor is not confirmed by Congress. So Congress doesn't get to select who that person is, and this person is arguably right next to the president and is the most important and generally the most, at times, often very powerful person on all national security matters. And that person does not get a vetting or a Senate confirmation vote. The National Security Council is also part of the Executive Office of the President, which means that its deliberations are protected by executive privilege. And executive privilege basically means that the president has the right to deliberate with his or her advisors without like undue sort of interference for the deliberation process. So this concept of deliberation, particularly in the White House, is protected. And departments and agencies will also try to protect deliberations from Congress. So remember how I said Congress can pull documents and compel documents and subpoenas, and their GAO can come in there and ask for like truckloads of documents? The lawyers in the departments and agencies will generally try to protect deliberative documents. They're not able to do it sometimes, like all the time, but the White House privilege tends to be a lot stronger than that afforded to the departments and agencies. So that's another reason why there's always a thorny relationship with the National Security Council and Congress. The legislative staff on the National Security Council and the lawyers of the National Security Council will very rarely let anyone on the National Security Council staff ever speak to Congress. So whereas when I worked at USAID, I was constantly being thrown up to the wolves on Capitol Hill to explain myself, but more importantly, what my bosses were doing. But when I was on the National Security Council, like never once. In fact, we were forbidden to do that. And it was all because of an intention to protect the president's space to deliberate without having to answer prematurely to anyone out there. So that's what I will say right now about the National Security Council. Global health took a lot of space on the National Security Council. In my time, we had the Ebola crisis, we had Zika, we had several health emergencies. There was a lot of work done to try to advance the global health security agenda, keep PEPFAR going, keep the President's Malaria Initiative going. The Global Health Security Office did a lot of work on pandemic preparedness. During COVID, the Trump NSC did a lot of work around COVID. There was a lot of convenings. Under the Biden administration, we did not have as many health emergencies, thankfully, but still there was a lot of work done around global health. Every national security advisor that I served under kept an eye on all of these issues and really at times directed implementation and policy. Another thing to mention is supplemental appropriations. So when we had health emergencies during the Obama administration for Ebola and Zika, the president made the decision to ask for supplemental appropriations. That meant that was voted on by Congress. We got supplemental appropriations for Ebola, global health security, Zika, and then COVID. During the Trump administration, President Trump also asked for supplemental appropriations, including on the international side for COVID. So it's very important to the White House, especially when it comes to infectious diseases and pandemic threats. So it's an interesting place to be if you ever end up there in your careers. But it's, you just never know how it's going to be set up or what will happen there. So I will stop there and happy to take questions or comments.
The National Security Council advises the president on, for example, increased funding for Zika prevention on security grounds. How does that go to the appropriations and for the funding of the intervention?
Very good question. Okay. So the way it works is, I'll just tell you how it worked actually in real life. So the way it worked was that after the National Security Council kind of deliberated on it, like kind of across all 5 committee levels, including the president held a National Security Council. the decision was made that a supplemental funding request should go to Congress. And the way it works, it is the Office of Management Budget, which is also part of the Executive Office of the President, puts together that request. So OMB went around to all the departments and agencies and said, how much do you want? How much do you need? Then OMB will ask the departments and agencies, like State Department, wait, I don't really think you need that much. And they'll kind of put you through the ringer and have you do like multiple Excel spreadsheets on why you're asking for this and why you're asking for that. And finally, OMB will pull it together in a package and then formally present it to Congress. It formally goes as a letter to the Speaker and like the Senate majority leaders and the minority leaders, majority leaders, to all kind of four sides. And then essentially what happens is they will immediately kick it to the Appropriations Committee. And they'll be testing to see what kind of support there is. They'll be doing soft like counts. And then the Appropriations Committees will take that request and essentially draft the language to support it. And then the Appropriations Committees will go back to the same people and say, I don't really think you need that, or why do you really need that, or this math doesn't add up, or 30 cents is off. So then they'll kind of go through their own process. And then essentially the Appropriations Committee, oftentimes when it's fast moving like this, they will go directly into what is called a conference. And a conference means like the Republican, Democrat sides of both the Senate and House will literally sit down together in a locked room and a computer and draft the legislation and negotiate everything out on behalf of their sort of corners, their leadership, and their bosses, and basically come up with what that legislation looks like. While they're doing that, they're typically calling over to the departments and agencies. They want information, they want briefings, they're making assessments, they're talking to their members. They can pull it together pretty fast. And then essentially, sometimes it will just bypass the whole committee process and it'll go straight to the floor for a vote. Sometimes it'll go through the committee process. When it's a supplemental, it tends to just go straight to the floor. It kind of depends. But that basically is how it'll happen.
I have a question just related to Zika and Ebola and COVID as well. How were you gathering the information that these infections were happening? And then how would that information come to you all as the committee? Is it through the CDC or through other outlets?
Oh gosh, that's such a good question. Honestly, it was often it's kind of crowdsourcing information. So when we finally figured out Ebola was the thing, then we would have CDC and USAID pull together regular dashboards to report out the cases, and they would generally get it from WHO and partners on the ground. They would kind of pull together sort of information. We would also have the Situation Room kind of check open source reporting. There's also some classified channels that we would be checking. And so we would often serve as a node to kind of pull together these different disaggregated pieces of information. But it can take a lot of different forms. The Zika, you'll find this interesting. Zika, we figured out Zika was kind of an issue in causing this microcephaly condition in infants, frankly, through flu trackers, just Twitter. And there's this little flu at the time, it's flu trackers was this little kind of I don't know, this kind of weird, loose, hey, you see something weird, say something and we'll put it out there. And we started seeing this on flu trackers before we saw it anywhere else. And then we're just this is so weird. Could this really be? Because Zika had been around as a virus. It had just never caused these birth defects before. So it caused us to ask questions of CDC and say what's going on. They're well, we've never seen this before. It's probably fake news. But then eventually we're no, it's probably not. So flu trackers was our source to start with, and then CDC did further investigations, and they're wow, we think this is actually real.
So really interesting, and I think timely, because I'm just curious with defunding of USAID and reducing funds of the CDC, how are we tracking what's happening in the world with infectious disease? I mean, the Zika is very interesting with the flu tracker, and I don't know. How are we keeping a pulse on what's happening in the world?
That's a good question. I'm not really sure at the moment. I think, look, WHO still has its like GORN network, and it's like that. It's called like Global Outbreak something response network. There's CDC still has its like surveillance networks. Flu trackers, I think, still exist somewhere, and I'm aware of like a few different private sector kind of university efforts to create more robust biosurveillance systems, especially using AI tools to really kind of rapidly process data and anomalies faster. The military also has a biosurveillance network in places that it works. So, the US Department of Defense has a whole sort of biosurveillance wing to it. I feel like it's easy to miss something until it kind of turns into like an outbreak or an epidemic. And this is always the challenge, is to find something early and like stomp it out and contain it quickly. I feel like we haven't really gotten there yet.
What was the most exciting, or which memo or policy report that you worked on that you can share? What was the topic and what were you excited about?
Oh gosh. Honestly, I don't quite remember the topic. I think it might have been like an Ebola global health security kind of a like memo that got sent to President Obama, and he essentially like scribbled like handwritten notes back to me on it, which was like, this is really interesting. Keep working on it. Do it really fast. So that was kind of exciting to kind of get and so because President Obama was like just known as this like voracious like reader, and I guess lore has it that he would like take like a stack of memos and go up to his like private study and eat like almonds until like 2 in the morning and read them and like scratch them up. And like the memos had like a title. They were called BFOs, and so they're called Back from the Ovals. So they'd basically, so then like the Situation Room was like, hey, you got a BFO. I'm like, a what? A BFO. I'm like, what's a BFO? Back from the Oval. So that was exciting. What else? Myself and my colleague, Julie Schaefer, we wrote the memo to the president saying, by the way, we found a new horrible virus called Zika, and it's causing birth defects and brain defects in infants. We were the ones who drafted that memo to the president, and then 48 hours later, he called a National Security Council meeting in the snow. So I'm like, how am I going to get to the White House when like my street is blocked off? So there was that moment. There's a few.
When writing policy briefs or that kind of memos to the president, what level of detail are you going into?
So, it really depends on who you're writing for. So my understanding is that like President Trump really wanted very short memos. President Biden, I think, very short. President Obama like loved details. So like my boss Samantha Power at USAID, she loved details. Like she reads reams of paper in the middle of the night. So we had to really write for her style. What I like to do, and I have this on the other, I have it up here too, is I like to do like a bottom line up front paragraph, and then you go into sort of details by section. But you get to the main point up front, which is generally to say, like, here's the issue, here's why it matters, here's the decision we need, or here's the key point that you need to remember. And then if somebody wants to read the details, they can read the details, but if they don't want to read the details, that's fine too, because like you just want to get the key idea sort of stuck with them. And so I tend to write a lot of like bottom line up front kinds of style memos.
Question, so moving forward, what would you say would be the most strategic way for people with a background in STEM, engineering, science, public health to make sure that like international development and global health remain an important topic? Like, is that through like government or more of the private sector or academia, from your understanding, seeing how things quickly shift with switching of administrations like every 4 to 8 years? What do you think would be the most strategic way for someone to like work in the global health and international development sector strategically?
So I would say at this moment in time, especially for students, because this is a tough time for folks trying to come into the field. I think it may pass, it's going to reverse itself. But given sort of the ups and downs, I would say that you should think about like really honing in and developing a very like hard skill or a hard craft. And so by that I mean like maybe some of you are thinking about going to med school. Do that. Maybe some of you are thinking about doing some like advanced biomedical engineering. Definitely go ahead and do that. So learn like a hard STEM skill that could be applied in the private sector, in research, in academia, or in global health. Because once you have that skill, it's very transferable depending on like what happens. Because we had so much funding coming into the global health world, you know, USAID and State Department, and also the NGOs, everyone staffed up quite a lot. But I think we kind of got, if you guys come to my talk tomorrow night, you'll hear about this. But like, I think we got into this kind of cycle where we had a lot of funding. So therefore, if you're a donor, you want a lot of reports, you want a lot of oversight. And now when the money's gone, those jobs just kind of vanish, right? And so I think that the industry and even USAID, even I think like USAID overstaffed at times for certain things. And it's at the detriment now of people who are trying to find work in this field. But if you have something that like, okay, you can be an epidemiologist at CDC, or you can be an epidemiologist for like, you know, Johns Hopkins, or you can be an epidemiologist for essentially like a pharma company. That's a very transferable skill. Same thing if you're a physician, or same thing if you like have like a hard kind of, I don't know, if you're a chemist. It doesn't really matter what it is. But I think at this moment when there's so much uncertainty in the field, definitely lean into that. So what it means is like maybe you're not gonna do global health immediately after graduation. Maybe you'll like kind of do something else, but you'll find ways to kind of stay engaged. And then when the opportunity is there, you can jump into it. You can also like, you know, do like, you know, a year in the field or go overseas or, you know, do something like that while you're still doing it. But I might have given you different advice like 2 years ago, but at this moment, this is the advice I would give you.